Do you believe that each individual American should be required to have health insurance?
I have come to that conclusion. During the campaign, I was opposed to this idea because my general attitude was the reason people don't have health insurance is not because they don't want it, it's because they can't afford it. And if you make it affordable, then they'll come. I am now in favor of some sort of individual mandate as long as there's a hardship exemption. If somebody truly just can't afford health insurance, even with the subsidies that the government is now providing, we don't want to double penalize them, and we want to phase this in a way that we have time to make sure that coverage is actually affordable before we're saying to people, go out and get it.
Mr. President, when people hear you talk about a national insurance plan, there are fears of socialized medicine, rationed care, limited choice. How do you handle this?
You know, all I can do is just keep on repeating the absolute promise that I have made. If you've got health insurance that you're happy with, you've got a doctor that you're happy with, we don't want you to do anything. We don't want you to change. What we are saying is that if you don't have health insurance, if you're underinsured, then we're going to lower your costs. We want to give security to people because there are a lot of folks out there who have health insurance, but what they don't realize is that they're one job change away or one lost job away from suddenly being in a very disastrous situation. We want to prevent that, and that's what this reform can do.
Let's talk about how you get rid of unnecessary procedures.
Yeah.
You've said that if doctors have the information, they'll do the right thing. And generally, I like to think, I'm a physician, I'm practicing, I like to think that's true. But actually, there are a lot of times when that's not the case. For example, angioplasties, elective angioplasties, where you open up a clogged artery in the heart. It turns out that about 30% of them are unnecessary.
Right. Why are they still ordering them, do you think?
I think that because they believe there's this thing about if an artery is closed, it's got to be better if it's open. And it turns out that's not true. So how do you make that doctor do the right thing?
I have enormous faith in doctors. I think they always want to do the right thing for patients. But I also think, if we're honest, doctors right now have disincentives to making the better choices in the situations you talked about. So it's a combination of better information, and then I think a different system of reimbursement that says, let's look at the overall quality of the care of the patient.